Her name was Dorothy. She was 83 years old. On April 9th, 2026, she had a massive stroke. The stroke damaged the part of her brain that controls swallowing. She lost the ability to eat or drink safely. Her doctor said she needed a feeding tube, or she would not survive. Medicare Advantage denied the feeding tube 5 times. Dorothy died 26 days after her stroke. The cause of death listed on her death certificate was malnutrition and dehydration due to denied medical nutrition therapy. She died because an insurance company decided a feeding tube was not medically necessary. Dorothy had been a librarian for 42 years. She worked at the same branch library in a small town where everyone knew her name. She knew what books the regulars liked. She ordered large print editions for the older patrons. She ran the summer reading program for children every year. She retired in 2019. She lived alone in the house she'd owned for 50 years. She was independent. She drove herself to the grocery store. She volunteered at the library twice a week. She had book club on Thursdays. She was managing just fine. April 9th started like any other day. Dorothy woke up. She made coffee. She was reaching for the newspaper when her right arm stopped working. She tried to call out, but the words wouldn't come. She fell. Her neighbor found her 3 hours later when she came to return a book Dorothy had lent her. The neighbor called 911. Dorothy was rushed to the hospital. The CT scan showed a large ischemic stroke in the left hemisphere of her brain. The stroke team started treatment immediately. They couldn't reverse the damage that had already occurred, but they stopped it from getting worse. Dorothy survived. But the stroke left her with right-sided weakness and severe dysphagia. Dysphagia means difficulty swallowing. After a stroke, the muscles and nerves that control swallowing can be damaged. Food or liquid can go down the wrong pipe into the lungs instead of the stomach. This causes aspiration pneumonia, which can be fatal. A speech-language pathologist evaluated Dorothy 2 days after her stroke. She did a swallow study using special imaging to watch what happened when Dorothy tried to drink. The liquid went straight into her airway. Dorothy coughed and choked. The test was stopped immediately. The speech pathologist's assessment was clear. Dorothy could not safely swallow anything by mouth. Not food, not water, not even her own saliva. She was at extreme risk for aspiration. Dorothy's neurologist explained the situation to her family. Without the ability to swallow, Dorothy couldn't get nutrition or hydration by mouth. In the short term, she could receive 4 fluids and nutrition. But 4 nutrition is not sustainable long term. It doesn't provide adequate calories. It can cause liver damage. It increases infection risk. The standard of care for stroke patients with persistent dysphagia is a feeding tube. The most common type is a PEG tube, which stands for percutaneous endoscopic gastrostomy. It's a tube inserted through the abdominal wall directly into the stomach. The procedure takes about 20 minutes. It's done under light sedation. Recovery is usually smooth. Once the tube is in place, liquid nutrition can be delivered directly to the stomach, bypassing the swallowing mechanism entirely. April 11th. Dorothy's neurologist submitted the prior authorization request for PEG tube placement. He included the swallow study results. He included the speech pathologist's evaluation. He included documentation showing Dorothy was alert and had good neurological recovery otherwise, but could not swallow safely. He marked it urgent. Patients can't go weeks without nutrition. The first denial came back in 48 hours. The reason given was not medically necessary. Try thickened liquids first. Thickened liquids are sometimes used for patients with mild dysphagia. The thicker consistency moves more slowly and is easier to control. But Dorothy's swallow study showed she couldn't handle any consistency safely. Her speech pathologist wrote a letter explaining this. She stated clearly that thickened liquids would not solve the problem and would put Dorothy at high risk for aspiration pneumonia. The neurologist resubmitted with this additional documentation. Second denial. Patient must fail speech therapy swallow evaluation first. Dorothy had already had a swallow evaluation. That's how they knew she couldn't swallow. Her daughter called the insurance company. The representative said the policy required patients to complete a course of swallow therapy before a feeding tube would be approved. Dorothy's speech pathologist explained that swallow therapy is for patients who have some swallowing function that can be rehabilitated. Dorothy had no safe swallow. There was nothing to rehabilitate at this point. Therapy might help in the future, but she needed nutrition now. She submitted another appeal. Third denial. Alternative nutrition options available. The insurance company's position was that full nutrition was adequate. Dorothy's neurologist wrote a detailed letter explaining why full nutrition was not appropriate for long-term use. He cited medical literature. He explained the complications. He stated that every medical guideline for post-stroke dysphagia recommended enteral feeding via PEG tube for patients who could not safely swallow. He submitted the appeal with supporting documentation from the American Stroke Association. Fourth denial. Facility must attempt oral feeding for 30 days first. Dorothy was not in a facility. She was in a hospital. And attempting oral feeding for someone who had failed a swallow study was dangerous and not medically appropriate. Her family was confused. Every denial gave a different reason. It felt like the insurance company was just finding new ways to say no. Dorothy's neurologist called the medical review department. He spent an hour on the phone. He finally spoke to a physician reviewer. He explained the case. The reviewer said he would escalate it. Fifth and final denial. Feeding tube denied permanently. Patient can survive on 4 hydration. Dorothy had been in the hospital for 16 days at this point. She was receiving 4 fluids and minimal 4 nutrition. She'd lost 14 pounds. She was weak. She was confused. Her family could see her declining. Her neurologist told them honestly that he didn't know what else to do. He'd never had a feeding tube denied for a stroke patient with documented dysphagia. This was standard medical care. He encouraged them to continue appealing, but he said the insurance company seemed determined to deny it. Dorothy's daughter asked if they could pay for the feeding tube themselves. The hospital gave her an estimate. The procedure was $6,000. The tube itself was $800. The hospital facility fee was $4,000. Follow-up care was additional. Dorothy's daughter didn't have that kind of money. She worked as a teacher's aide. She had 2 kids in college. She called her siblings. None of them could come up with that amount. They were ordinary people with ordinary incomes. They couldn't afford to pay cash for a medical procedure that insurance should have covered. The hospital tried to keep Dorothy as long as they could, but after 3 weeks, her insurance stopped paying for the hospital stay. They said she was medically stable and didn't require acute care. She needed to be discharged. But she couldn't go home. She couldn't eat or drink. She needed 24-hour care. She was transferred to a skilled nursing facility that accepted patients on IV nutrition. The facility staff did everything they could to keep Dorothy comfortable. But 4 nutrition alone is not enough to sustain life long term. Dorothy continued to lose weight. She lost muscle mass. She became weaker. Her skin became thin and fragile. She developed pressure sores. She was hungry. The nurses said she would gesture toward food. She would point at the meal trays being delivered to other residents. She clearly understood that food was there, and she wanted it. But she couldn't have it. They tried to explain to her why, but it was hard to know how much she understood with her stroke-related communication difficulties. 26 days after her stroke, Dorothy died. Not from the stroke itself. The stroke damage had stabilized. She died from the complications of malnutrition and dehydration. Her body simply couldn't survive without adequate nutrition. The death certificate listed the immediate cause of death as metabolic failure. The contributing factors included malnutrition, dehydration, and dysphagia status, post-cerebrovascular accident. In the section where physicians can note other significant conditions, her neurologist wrote, "Denied enteral nutrition support." This is not an isolated case. Stroke patients across the country are being denied feeding tubes. Insurance companies are requiring patients to fail alternatives first. They're claiming IV nutrition is adequate when medical evidence says it's not sustainable. They're denying standard post-stroke care to save money. A PEG tube costs about $10,000 total. Keeping a patient in a hospital or nursing facility on IV nutrition costs thousands per day. The insurance companies aren't even saving money in most cases. They're just delaying care until patients either recover enough swallow function on their own or die. The American Stroke Association guidelines are clear. Patients with persistent dysphagia after stroke who cannot meet nutritional needs orally should receive enteral nutrition via feeding tube. This is evidence-based medicine. This is the standard of care. But insurance companies are overriding medical guidelines with their own policies that have nothing to do with patient care and everything to do with cost control. If your mother, your father, anyone you love has had a stroke and cannot swallow, you need to know this is happening. Feeding tubes are being denied. Patients are being told to try alternatives that medical professionals know won't work. People are dying from malnutrition while appeals are pending. Ask the medical team what the plan is for nutrition. If a feeding tube is recommended, ask if prior authorization has been submitted. If it's denied, appeal immediately. Get documentation from every provider involved stating the medical necessity. These stories need to be told. Every stroke patient denied a feeding tube. Every family watching their loved one decline from malnutrition. Every physician who had to tell their patient they couldn't provide standard care because insurance wouldn't approve it. Share these experiences. Document them. Make them impossible to ignore. This is preventable. Dorothy should be alive. She survived the stroke. She died because she was denied the nutritional support she needed to recover. And right now, someone else is being told their feeding tube request has been denied, and they should try thickened liquids first, even though the swallow study shows it's not safe. Right now, as you finish this video, another grandmother who survived her stroke is pointing at someone else's food tray. Because Medicare Advantage decided thickened liquids are enough, subscribe, because next month it could be your mother starving to death, fully conscious, for 26 days.